Decriminalization was a good idea.
Strong proponent of decriminalization. I completely agree with the mayor that the stigma associated with addiction to illegal drugs is a big part of the problem that we're seeing right now. And the fact that illegal drugs are now contaminated with substances like fentanyl. The first step is decriminalizing, because that, we hope, will address some of the stigma associated with illegal drug use. Ultimately, we'd like to see a regulated approach to all psychoactive substances, legalization and regulation, as we are now doing for cannabis. That may be a long way away, but we need to continue to advocate for that even as we deal with this crisis.
So in the meantime, we have people dying from tainted drugs, fentanyl in their opioids, heroin, cocaine, you name it. And a lot of people, more and more people are coming forward saying, you know what, medical marijuana can play a role in helping fight the opioid crisis. I've heard about it a lot. I have not actually talked to anyone about it, but I'm about to, because Dr. Michael Verbora is on the line. He's the chief medical officer of Aleafia Health. This is a medicinal cannabis company. He's also a professor at the McMaster University Medical School. Dr. Verbora, thank you so much for joining us today.
Thank you for having me.
How can cannabis help an opioid addict? I don't get this.
Yeah, it sounds quite controversial and interesting at the same time, but we've known now for a number of years, the science has shown that cannabis can indirectly work on the opiate system in our bodies. And in addition to working on the opiate system, it works on many other systems that reduce inflammation and relax muscles. And through those effects, we can help people with pain and therefore reduce their opiates.
So I get the pain part of it, because I know a lot of people do use medical marijuana for that. But when you're an opioid addict, don't you need a much bigger hit?
Well, it's complicated, but many of the opiate addicts that we have now on the street, 80% of people using street opiates start with a prescription from a doctor's office for a prescription opiate. So the root cause of this problem is the past ways that we've treated pain. And now over the last few years, as a physician who's been prescribing cannabis, I've been fortunate to have gotten hundreds of patients off opiates. Many of them, one of them particularly, was on fentanyl and hydromorphone and didn't really have any resemblance of a normal life. And just over the course of 3 to 6 months, with coaching and the use of cannabis, we were able to get him off all of his opiates.
We're talking about hardcore addictions to opioids, that these people can come off of it with medical cannabis?
Yeah, absolutely. So, like I said, the opiate problem, it starts with a prescription and it slowly evolves over time. And the reality is in my office, when I'm meeting with patients, they may not be getting their opiates from the street. They may be getting it from a pharmacy, but they have exactly the same problems that the patients have on the street. They're dependent on it, and they know that if they miss a dose, they're going to withdraw from it. And that's actually the biggest fear with opiate addicts is it's less and less about the symptoms that they were originally treating. It becomes more about the withdrawal. And whether you're on a low dose, a medium dose, or a high dose, that withdrawal is real, and it's not a pleasant experience. And cannabis can help eliminate many of the side effects of the withdrawal, and it can actually help patients lower their opiates.
So doesn't it mean, though, just switching a reliance on one drug for another drug?
Well, some people would say that, but the reality is we need to be doing absolutely anything we can to get opiates out of the hands of patients or people. Right now, the problem is such a crisis, and it's North America-wide, that anything that we can do to remove opiates is a step in the right direction. Cannabis does not have the victims that opiates do. And at Aleafia, we are 100% committed and invested into this problem, this opiate crisis. We are on the front lines, and we're now doing a 1,000 patient study looking at just what size of an effect can we achieve when we switch opiates with cannabis. And over, I hear the same story over the past 3 years, and that is when I substitute opiates with cannabis, I can live a better life. I can have better relationships. My sleep improves. My appetite improves. My depression is reduced. And that's a combination of the cannabis and also the reduction of the opiates.
What do your other colleagues in the medical community think about using cannabis to treat opioid addicts?
So the medical community has definitely evolved. I've been in this space now for the last 3 to 4 years, and when we first started doing this, there was, a number of skeptics, and rightfully so, and there was limited research and evidence. But more and more, we're seeing scientific studies being done and research being done. We now know that in the United States, in states that have access to medicinal cannabis, there's a 25% reduction in opiate overdoses. So the data now is starting to support what we've been seeing anecdotally. So more and more physicians are feeling comfortable with substituting cannabis as a much safer alternative to opiates.
And what about government? Are you starting to see them look at the realization that, hey, this could be the answer that we're looking for here when we've got a crisis with 4,000 Canadians dying every year?
Yeah, that's probably where the biggest gap is, I would say, is right now we're not seeing a lot of money in the clinic side being channeled to conduct the proper studies and research that we need to do. And there are still many barriers for my patients, and that's primarily financial. So opiates are still free for many people who are on a provincial or federal insurance plan, or if they're on a private drug insurance plan, opiates tend to be covered. And cannabis still is not covered. So not only are you trying to convince someone to switch to a different alternative, you're also asking them to take on $100 to $200 to $300 a month expense. So it makes it even more difficult. I can only imagine the effects and results we would achieve if this was covered by our government or other insurance plans.
And so what are you doing to that end? Are you lobbying government to change the rules?
Yeah, so at Aleafia, we are 100% committed to the opiate crisis, and we definitely see through our experience and our research that this is a viable option, one of many alternatives to reducing opiates, and we are in the process of lobbying. We are conducting the proper studies. I think the government does want to see value for its money, and it wants to see some of the evidence that we have, and I have no doubt that in the future that some of these barriers will be reduced and more people will be using cannabis to safely get off of opiates and hence reduce the harm and risk of death.
Well, good luck with it. Fascinating conversation. Thank you so much for your time today.
Thanks for having me.
That is Dr. Michael Verbora. He's the Chief Medical Officer of Aleafia Health. This is a medicinal cannabis company. He's also, though, a professor at the McMaster University Medical School.